Thanks for joining us for part two in our latest In Conversation With, where I'm speaking with Askathari and Hisham Hamid from Guy's Hospital, as well as Masi Cariati and Petros Charilampidis from University College London Hospitals. Now, in part one, we talked about the establishment of London Cancer Hubs, the collaboration between the NHS hospitals and independent sectors in London. And in part two, we're going to talk about managing patient safety in the hub, getting patients to come back in for their screening mammograms, and also how technology like Magseed have helped make some of the treatments possible in these new hubs. You've mentioned already how important patient safety is throughout this entire process, but I'm interested to know a bit more. Does this mean that you weren't able to treat as many patients as you could in your normal NHS setting?
We were able to essentially treat pretty much every one of our patients without building up a significant backlog. The only exception being very comorbid patients, i.e. people with very significant other medical problems that would anyway put them at great risk for surgery. And despite an initial suspension of immediate breast reconstruction, related once again to the complexity of the surgical procedure and the safety concerns surrounding it in COVID, we were then able to cautiously reintroduce immediate breast reconstruction as well. So reducing the number of patients seen in the individual clinic, widening the gaps between appointments to allow thorough cleaning of all surfaces to reduce contamination, reducing the numbers of patients in waiting areas, once again to allow social distancing, and then more recently asking patients to wear a face mask upon entering our building. Our clinic is within the cancer center. All clinicians to wear a face mask in clinical areas during clinical hours to once again reduce the risk of contamination and of infection or exposure to COVID itself. And that has actually also given us excellent results. Patients have been screened, clinicians have been screened, and there have been, none, but maybe one or single digit positive COVID screens in the patients attending the cancer center. So we're able to establish a very safe pathway.
What Mas is saying has been instrumental in our communication with patients, because from early on in the pandemic, patients were overwhelmed by the news. So naturally, a few of them with comorbidities felt that it was not appropriate to visit the hospital for any reason. And as the weeks unfolded, we felt as a clinician body concerned that whilst a tremendous amount of focus is put on the COVID health related part of it, people would start becoming unwell with non-COVID conditions. And we, from a very early on, by building this hub, by building this framework of safely being able to see patients, we iterated the message to the community that we are here, we're open, we can see you, and we will treat you. So our mission was to start reinvigorating the concept of safe healthcare even within the COVID era, and the hub creation played an instrumental role with that.
No, that's really great to hear. Unfortunately, there's been a lot of coverage in the news recently about how breast cancer referrals are significantly down over the last few months. How worried does that make you as breast surgeons?
I've been in close contact with the clinical leads and the hub leads from the rest of London. Throughout London, we have witnessed a significant drop in the number of referrals coming through to the breast clinics, with some sites seeing as little as about 15 or 20% of the usual numbers. There is a safe pathway that has been created to make sure that patients can be safely assessed, and that ultimately patients should continue to remain breast aware. They should continue to pay attention to whether they develop symptoms, and if those symptoms persist, they should seek review to make sure that they provide either way reassurance, if, as is the case in the majority of patients, the findings ultimately end up being benign, but that if, unfortunately, there is a diagnosis that is made, that can be treated effectively early on.
Well, that's perfect. I really hope we'll see referrals back up to normal levels soon, just so we're not storing up another crisis for later down the line. Going back to the hubs for a second, you've obviously been up and running for a few months now and would continue on for a while. It'd be great to hear about some of the learnings you've already found. Perhaps there are new ways of working. Ash and Hisham, perhaps you could start with this one.
One of the things is there has been a great peer-to-peer communication around hubs and clinical prioritization groups, where some clinicians who are not very comfortable doing certain procedures have come forward and said, are you happy to take the care over this patient and provide the service? And bigger academic centers have come forward and been helpful, working collaboratively with them. So, MagSeed, we've offered to train surgeons in the Southeast network with MagSeed, because they never used it, but they came and saw us in the hub using MagSeed, and they were mesmerized and said, why can't we do this? And we said, yes. So there are learnings where, you would find from the hub, especially from the London hub, it's very important for clinicians who are not very good with reconstruction, they'll have doubts, to talk to other peers and say, look, there's nothing wrong with doing a reconstruction, provided you do ABC, where you have capacity, you have the patient safety at heart, and make sure that it's in a COVID light or COVID clean environment at least for the foreseeable future. For 30 days, the patient never hits the NHS hospital.
We've allowed the identification of new ways of working, virtual working for meetings, that actually has released a lot of resources, utilize the technology like MagSeed more regularly, that has allowed us to sort of work more intelligently across sites. And so we've learned a lot. We've learned that patients, certain types of appointments, they rather have as virtual appointments rather than necessarily coming and queuing up at a cancer center.
So if you put these pathways in, then it gives confidence to patients, to clinicians, to then say, okay, there's nothing wrong with me providing what the patients asked for. You also now know that endocrine treatment is very good at downstaging patients, and not everyone needs chemotherapy. Mitch Dowsett's team down at the Royal Marsden came up with this great toolkit that London Hub made available to all the hospitals, where they use the ER, the PR, and the Key 67 data. And they tell you patients that will respond better to endocrine treatment. And I think those will stay, because now it will be very hard to roll back the good things that have been done. Because the surgeons like us will say, hang on, you were happy to do it then, why aren't you doing it now? So at the end of the day, the patients will benefit from all this.
Oh, it sounds like there's been a lot of positive to take from this, despite all of the challenges. I'm just wondering, from a surgical perspective, has working more closely with other centres allowed you to try new technologies? And do you think the hubs are a good place for innovation?
So you have the prioritization group, which looks at certain things, and especially clinical trials. You don't have to go to each individual hospital and try and talk to them. It goes through the hub, and you will have a proper rollout and a fast yes or no, probably. So you know whether you have that critical mass of patients available to you, there's a willingness. And if there's resistance, why there's resistance? Because you'll always get certain people who are very pro new technology and certain people who are very resistant to change, because this has been working well in my hands, why the hell should I change it? That is something that, a perception that has to be challenged, because innovation is always for the better of patients.
Using the MagSeed during COVID was instrumental to smooth out the pathways. And that was enforced by the confidence we had in using MagSeed just before COVID. We were already, at UCLH, we were already a year in using it as almost standard practice instead of a wire. So we were quite confident to use its full potential during COVID.
We have, generally speaking, low rates of excision, and part of that is thanks to MagSeed as well, for sure. In terms of occult lesion localization, it certainly makes a difference, massive difference over wires. Both Petrus and I have had experience also before our appointment at this trust, and we're fully behind the technology. We think it just revolutionizes the way we treat occult lesions.
I'm very optimistic that certainly the London Hub will be a good place to try new technology, because I think despite the fact that as Ash said, we are all individuals, we challenge our practices all the time. I think we are fortunate to have a group of clinicians who are willing to work with each other and willing to learn with each other for the good of the patients. So there is a healthy environment, and I hope that this close collaboration and working as a team, I hope that it will not fade away after the crisis is over.
Yes, here. I hope that too. It's been wonderful to see just how this old institution that we've all grown up with and love has suddenly become nimble and fresh and shown it can adapt really quickly to these changing times and is still there when we need it.
It's just a shame that we needed something like COVID to bring the best out of us.
But it's good to know that that best was in there. And I think that's nice to know.
And so I think we've got a positive message. That is, it's essential that we utilize this as an opportunity to establish these new ways of working for the future, to make our utilization of resources more effective and our services more modern in general terms. And the opportunity is there. And I know that there is consensus, certainly within London, to deliver these changes. We are certainly implementing them here at UCLH locally, and then liaising with the neighbouring trusts and across the whole of London to try and push for these changes to happen. You know, there's a lot of talk about second waves. Whether a second wave happens or not, we know that we'll be prepared for it. And there's confidence in knowing that.